The decision to have weight loss surgery at Methodist Hospital is the first step to making a commitment to change your life, a life filled with possibilities.
My health started deteriorating rapidly. Basically developed diabetes, high blood pressure, hypertension, sleep apnea, circulation problems in my legs. Came to the point I couldn't hardly get out of bed in the morning. It ballooned up to about 425 pounds at one point. You know, I just couldn't take it anymore.
I remember my family lives in Salt Lake, and we'd gone back to Salt Lake with them, and there's this hike to a cave. It's a pretty strenuous hike, but I'd done it as a child, and my girlfriend and I went on this hike. You have an hour and a half to get to the top. And we're there, and I've got a 2-year-old with me and a 5-year-old, and I couldn't make the hike. And all of a sudden I'm like, you know, my knees hurt, this hurts, that hurts, and I was very disappointed in myself, and it was kind of like I'd realized, wow, you know, my weight is holding me back.
Back in 1991, the National Institute of Health made a consensus statement, and they said that basically anybody who has a body mass index that's greater than 40 or greater than 35 with associated comorbidities, the only long-term solution to their weight problem is surgical intervention.
Lots of people out there are able to lose some weight initially, but being able to keep that weight off long-term is just not something that's very possible for almost the entire population that's dealing with morbid obesity.
I had thought about this for probably about 3 years, off and on, and we had a friend that had went through it, and she had great success, and it kind of cinched it for me.
It wasn't where I wanted to be, and I figured if you could do something about it, why wait? So that started my journey to Methodist Hospital. The procedure itself was ridiculously easy. I mean, it shouldn't have been so easy for the effect of it, the life change it had. And I have energy, and I can play, and it's just, I wouldn't trade that for anything. And ask yourself why you're heavy, and if that's how you want to live.
Don't continue to talk yourself out of it. You'll make, you know, the human nature is to make up every excuse in the world of why not to do it. And you need to stick to the reasons of why. I came to the realization that this is something that I had to do for me, because my family, those things that meant a lot to me, I couldn't be here for if I didn't do this.
There are several surgical procedures that have been proven to be effective in long-term weight loss. The preferred method used at Methodist Hospital is the Roux-en-Y gastric bypass. The Roux-en-Y gastric bypass is the most common procedure performed for weight loss. First step of the procedure utilizes stapling devices that divide the stomach to create a new stomach pouch. Normally the size of a football, the stomach is now reduced to the size of an egg. During the second step of the procedure, the small intestine is cut and reattached to an opening made in the new, smaller stomach pouch. The small intestine that is connected to the stomach is then reattached to the jejunum, forming a Y.
When the food travels down that roux limb, it's not exposed to the digestive enzymes of the bypass stomach, and that's how you get that malabsorptive effect.
Gastric banding is the second most common weight loss surgery after gastric bypass.
The lap band, simply put, it's like having a belt at the upper part of your stomach that you can tighten or loosen. It's done laparoscopically, 5 incisions, similar to the gastric bypass. Takes about 45 minutes to perform, and we do it as an outpatient.
Gastric bypass is probably slightly better suited for the very overweight one, whereas the sort of moderately to quite overweight person does well with the lap band.
Certainly there are advantages to both as long as you pick the right patient for each procedure. The Roux-en-Y gastric bypass is probably the gold standard in this country at this time, and it offers the ability to almost cure type 2 diabetes the day after surgery. And again, all the comorbidities that we see, including hypertension, dyslipidemia, asthma, sleep apnea, those things can actually go away.
A sleeve gastrectomy is the newest weight loss operation that we offer here at Methodist Hospital. Similar to a gastric bypass and a lap band, we perform the operation laparoscopically. Patients stay in the hospital overnight and go home the next day. The operation works similar to a band in that it's purely restricted. We basically remove the left side of the stomach, or the greater curve of the stomach, and make the new stomach into the size and shape of basically a banana. Clinically, what that means is a patient will not be able to eat the same amount of volume. They will have earlier satiety and decreased hunger.
Certainly there are risks involved with any surgery that we do, whether it's bariatric surgery or general surgery. We talk about the basics being bleeding and wound infection. Those risks are very, very small in these operations because we perform the surgeries through 5 small incisions that are less than 1 inch in length. We also talk about blood clots that can occur in the legs and move to the lungs. That's called a pulmonary embolus. That risk is probably less than 1% with our group. We take measures to decrease that risk to less than 1% as well. And then when you're talking about dividing the intestine, as with the gastric bypass, certainly there are risks for leaks from where we make our connections. Again, luckily with our group, being a center of excellence, our complication rates are actually lower than the national averages.
It is always difficult, you know, walking around feeling like you always felt and decide to go in and have a surgery done. No one really likes to have operations done. But the data out there now is that it's substantially more dangerous to stay the way you are than to have an operation done. So that's the thing people should consider.
Surgery is not right for everyone. It is not the best solution for someone looking to lose only a few unwanted pounds. A calculation known as the body mass index, or BMI, is a widely accepted criteria to determine if someone is a candidate for surgery. Most candidates should have a BMI of 40 or higher. If a prospective patient has other illnesses, such as diabetes or heart disease, a BMI of 35 or higher may be acceptable. A BMI calculator is available on our website at www.methodisthospital.org. You will first enter your height in inches. Then enter your weight. This is your BMI score. Compare your score to this chart to see if you may be a candidate for surgery.
Most patients come to us and they think, you know, I want the gastric bypass or I want the lap band, and you know, most of the time they're right. But there are some criteria that make one operation better for someone than the other.
As with any surgery, success is largely dependent on the skill and experience of the surgeon. The surgeons at Methodist Hospital are among the most experienced in the Los Angeles area. These surgeons together have over 25 years of experience and have performed over 3,000 weight loss procedures.
Whether they come with us or with someone else, try to look for some place that's a center of excellence, meaning you're going to have low risk of complications and really high good outcomes. Also looking for surgeons who are experienced in these procedures.
Methodist Hospital is proud to be recognized as a bariatric surgery center of excellence by the American Society of Bariatric Surgeons, a designation given to programs with a track record of favorable outcomes in weight loss surgery.
You want to go somewhere where there's high volume. You want to go somewhere where the facility, such as this one, Methodist Hospital, is well equipped.
Here at Methodist Hospital, we do have a variety of equipments that are appropriate for patients of size. We do have beds and chairs and walkers and wheelchairs, transfer devices that are used to provide a safe care for the patient.
The program has also been recognized by major health insurance plans as a preferred weight loss surgery center. At Methodist Hospital, weight loss begins long before the surgery and continues long after. The program at Methodist includes a multidisciplinary team that includes surgeons, nurses, dietitians, behavioral health specialists, and support staff.
Following bariatric surgery, the reality is that their diet will change dramatically, but we're there to help them understand what those changes will be.
Patients at Methodist Hospital do not navigate through their new life alone. Support groups are available to offer encouragement and reinforcement. And patients who are a year out of surgery are invited to celebrate their success at our annual Bariatric reunion. This is a time for patients to share their experiences as they travel along their journey.
We've known people that have done surgeries here, and the recommendation was always high. So we actually came to the hospital and checked it out before we even had the surgery. And I don't know, you just walk in, it feels like home.
The first step is to attend a free seminar. A schedule of upcoming seminars can be found on our website at methodisthospital.org or call 1-888-388-2838. Take the first step to becoming the new you. Weight loss surgery at Methodist Hospital. Imagine the possibilities.